oximeter. I put it on her finger and watch his oxygen. If it's going down or going up, you know, I'm getting paranoid. We keep on praying and praying that, you know, Dr. Hany will be the instrument for you to be straight, to be better, and to be corrected. After 3 days of giving birth to Jessica, we found out that there was a small hump on her back. The doctor found out that Jessica needs to be operated ASAP, and we need to do the MRI. But in the MRI, we had a little misunderstanding. The MRI department told us she's too young for the MRI, because they said it's risky for her to have the MRI. So from there, we stopped and we didn't go back anymore. But as she grew, we saw that she really has this curve. As she grows, became a little bit, you know, bigger, the curvature became higher. And then at 2 years old, I started consulting doctors in the Philippines, and then they cannot give me the exact diagnosis for Jessica. You know, as we consult scoliosis, they keep on telling us we have to wait for her perfect age to have the operation. So for now, she has to wear brace. Physiotherapist, which is specialized for scoliosis, but you know, it didn't help her. According to the ortho doctor in the Philippines, he said it won't help Jessica. The brace and the therapy won't help Jessica because it keeps on pulling her. It will make her scoliosis more prominent because of her case, because she has spina bifida, and because she's born with it. So we consulted a doctor in one of the prestigious hospitals in the Philippines, but he told us that Jessica will need 2 surgeries. And one surgery, the first surgery, will take 15 hours. And after 2 to 3 years, she will have another operation. So, and I asked him, is it risky for Jessica? And she said, yes. It's very risky for her. The first one will be very risky, and the second will be also. So, of course, hearing those things, that it will be risky for her for a 15-hour operation, we opt to find another doctor. We opt to find another hospital, and we are very blessed to see Vital and to see Professor Dr. Hany Abdel. That's why we are here in Dubai for the operation of my daughter, Jessica.
They call me Achi, which in Chinese means big older sister. I was homeschooled in grade 5 because in school my classroom used to be on the 3rd floor, and there's no elevator in our school, so we had to walk back and up, and the nurse room is on the 1st floor. And I kept going back to the nurse's room because I kept getting tired. I was also wearing a brace, and it made me a little tired. My muscles sore, so I kept going back there.
Jessica also stopped going to school. She's homeschooled. And for her not to feel that she's different, I asked someone to go to our house. It's a teacher where she can have her normal schooling. They do everything that Jamie is doing in their school. But still, her friends, there were times that Jamie will tell her stories about her friends. You know, sometimes he sleeps alone in the room without anyone. I have my own oximeter. I put it on her finger and watch his oxygen. If it's going down or going up, you know, I'm getting paranoid of her. So sometimes when it's going down, I wake her up and I told her, I'm just fixing you. So we got this air wheel for her. So now she's going to the mall and she's playing. But you know, even giving everything to her, there's this, lackness that she's longing for, to run, to play, to climb up the stairs, to use the slides with her brother. She always tell me, "Mommy, when I'm straight, can I play with John? Can I play with my brother? Can I swim?" And I keep on telling her, only the time will tell after the operation. So we keep on praying and praying that, Dr. Hany will be the instrument for you to be straight, to be better, and to be corrected. So we found out about Dr. Hany and we saw all the pictures and the video of him doing the surgery and the changes of the kids. And so we talked about it, my husband and I and Jessica, and we thought, let's go to Dubai, let's talk to him, let's consult Dr. Hany, and let's see what awaits there. So last October 2024, we went to Dubai with the feeling of hope, and we are anxious also, worried of what might be the consultation. I am so worried. He told us that Jessica's case is risky and that it's also a difficult case because it's not just the scoliosis. She has another problem aside from scoliosis, so it's a very complex one. But after talking to Dr. Hany, I have a bigger hope that he can help my daughter. And he told me that he will do his best and he will do everything to help my daughter. And so we went home to the Philippines with a very good news to the whole family that we can do the surgery. We can go back after 6 months. We just have to follow the instructions given to us that Jessica has to gain weight. And so we did our best every day, help her eat and give her all the things that he needs, the nutritionist, the vitamins, so she will gain weight. And then as we draw closer to this next visit, we have this hope that we will go back here and do the operation. But of course, the second time is never an easy one. So we went back and we talked to Dr. Hany. We had a consultation with him. And the second one is that he's sick. Because as we do the laboratory, we found out that Jessica's lungs is already compromised. So we have this fear that it's very risky for her to even do the anesthesia. How about what more? The surgery. So I'm very worried. Even my husband is so worried that he had high blood pressure of thinking that our daughter's lung capacity is not so good and that we don't have a choice but to proceed with the surgery because that's the only thing that will help her.
Today I have very complex surgery. Jessica, 11 years old, has multiple congenital malformation. She has been suffering since birth. She has splitted cord with bony septum between both cords. And she also has multiple cysts of water in her whole spinal cord. And her deformity reaching the pelvis. She was operated twice on her dorsal spine and lumbar spine to detessel the cord and remove the septum. So all her spinal cord exposed. Also, her weight is only 27 kilograms and she has very bad pulmonary function. So all the risk factors cumulated together in Jessica to make it very tough case with complex deformity, and I'm going to operate on her right now. Jessica's good. She's moving. She's moving. She's moving. She's moving. Moving both legs. I'm extremely happy for her. It was, and she will be fine.
Thank you.
Don't worry.
Thank you very much.
Thank you. You're welcome. You're welcome. You're welcome. I told you a lot about how difficult she is.
Yes.
She was more difficult even than my expectation. But we are good. She's moving the legs. Yeah. I will tell you something. I do nerve monitoring during the surgery. Every 1 minute, I test both legs. Every 1 minute. Just relax. Go upstairs. Keep you updated.
Thank you, Doctor. Thank you so much.
Okay? You're welcome. I just finished the surgery of Jessica. If we are talking about life-saving surgery, we are talking about the surgery of Jessica. It was extremely difficult and extremely high risk because of the multiple risk factors we mentioned before. But thanks God, Jessica now moving her legs after the surgery. Hello, Jessica.
Hello,
How are you doing?
I'm doing okay.
I want to know what is the difference between before and now?
Before I saw myself really short compared to my siblings. I had a big bump on my left hip. My shoulders were lopsided. My right knee was bended, and my left foot was tiptoed on the ground. And now my shoulders are straight. I don't have that big of a bump anymore. My left foot touches the ground, and when I push my hip to the right to make myself straight, my right knee gets more straight and less bended now.
Before, Jessica had a breathing problem, especially when sleeping, because when you're sleeping, you're not conscious, you're not breathing consciously. So I used to check her oxygen every now and then, especially when she's sick. And when she's recovering, I always check it every 30 minutes. I check it in the first 3 to 4 days. And then on the fifth day, I saw it's really going up. 99, 100, and 98 is the lowest. She's sleeping, and of course she's breathing unconsciously, but it's 98, it's 99, it's even 100 while she's sleeping. That's very impossible because I cannot get those numbers even she's breathing consciously. Even she's okay before the surgery. Now, after the surgery, my husband told me to stop checking it because every time I check it, it's 99, it's 100. What more if you wake her up? She stands up, she get out from the bed on her own. In 2 weeks, that's a very, very good result. That's why we stopped using the auto saturation. So before the surgery, when Jessica walks maybe 10 steps, 15 steps, she's already tired and out of breath. But now maybe 1 week after, she walks on the hallway. She walks there without resting. I think it's 20 meters. She can walk 5 times, 6 times without feeling tired, without getting out of breath.
After surgery, I was under pain medicine for 1 or 2 weeks. But after 3 weeks, I can walk without pain medicine and get through a day without it. Now, I can walk comfortably. I'm very happy because now I'm allowed to eat sweets and chocolates, because before we had to take the extra precaution to keep me safe. I want to say thank you to the hospital, to Dr. Hany for making me straight again, for making me breathe better so I can finally go to school again. Thank you to the nurses, to the cleaning staff. Thank you.
I want to thank Dr. Hany for giving Jessica a new chance to a healthier life. I am forever grateful to him, and I am forever grateful to his existence. Dr. Hany is such a gift to the medicine. I, as a physiotherapist, also myself and my husband is very thankful to Dr. Hany, for he is the gift for medicine.